Most people think that psoriasis is just a skin condition. But if you've started noticing foot pain, like heel pain, stiffness, or even swelling, this could actually mean that your joints are getting involved. And sometimes people confuse this with rheumatoid arthritis or other arthritis. But if you have the skin rash, the psoriasis, then we start thinking about psoriatic arthritis. And in some people, the first place that this shows up is actually the foot. And the tricky part is that it doesn't always look like typical arthritis at first. I'm Dr. Neha, rheumatologist. Let's dive in. One question I get a lot of is, why the foot? Why does psoriatic arthritis often show up here first? One reason is that psoriatic arthritis tends to affect areas where the tendons attach to the bone, what we call entheses. And the foot, especially the heel, is one of the most active areas in the body for that. Think about it. Every step that you take puts stress on your Achilles tendon, on the plantar fascia, the bottom of your foot, and the small joints in your toes. That's what walking is about. So if the immune system is already activated, like it is in psoriasis, it's an immune condition, those high stress areas are often where the inflammation shows up first. That's why a lot of people will just kind of put it to the side and say, oh, I think I just walked too much, I just strained something, or this is just plantar fasciitis. But when it keeps coming back or it doesn't behave the way that you expect it to, that's when we start thinking beyond just a simple mechanical problem. If you have psoriasis, there are a few patterns that I want you to pay attention to, because this is where things start to look different. And by the way, one quick misconception. If you've had some x-rays done of your feet and nothing has been seen on them, it doesn't mean that you don't have psoriatic arthritis. Because in early disease, the imaging, the x-rays, they can still look normal, which is why recognizing the pattern makes such a difference. Number 1, heel pain, especially if you have it first thing in the morning. A lot of people think this is plantar fasciitis, and sometimes it is. You're allowed to have that. But in psoriatic arthritis, it's often inflammation where the tendon attaches to the bone. Number 2, toe swelling. If you notice that your toe or even your finger looks puffy or sausage-like the whole thing is swollen, that's not typical wear and tear arthritis. Number 3, also stiffness. It's not just pain, but you feel like you don't want to move your foot or your toes when you first get up in the morning, or if you've even been sitting for a while. Sometimes I hear that people who have been driving for a while, and people seem to sit in traffic for a long time on the way to their doctor's visits, they're so stiff when they get out of the car and they have a hard time moving their foot. Sometimes they even stumble. Now, none of these symptoms on their own confirm psoriatic arthritis. But when you start to see this pattern, especially if you have psoriasis, we start to think differently. Okay, what about the difference between psoriatic arthritis and plantar fasciitis? The plantar fasciitis typically causes pain at the bottom of the heel, worse with the first few steps, and then it can loosen up as you move. So oftentimes it's about 10 to 15 minutes in the morning when you get out of bed, but after that, you feel better. Psoriatic arthritis, though, can feel different. It's often at the back of the heel, along the sides of the foot, and there's more persistent stiffness and swelling, like it doesn't always go away. And the Achilles tendon, that can really be involved. This difference it's subtle, but it's really important. And this is also where it can get really confusing with rheumatoid arthritis. But rheumatoid arthritis, or RA, affects the small joints. It's more symmetric. Both sides tend to be involved. And oftentimes the hands and wrists are what's early affected. Psoriatic arthritis behaves differently. It can just be on one side of the body, asymmetrical. It involves the heel or the toes. Toes can be in both though. But it can also show up in the tendon areas, not the joints. And I mean like large tendons. You can have tenosynovitis in rheumatoid arthritis in tiny areas, but not like the big tendon joints and the insertion points. That's more psoriatic arthritis. We call that enthesitis, and that's a big clue for psoriatic arthritis because that's where the tendons attach to the bone. So if your symptoms don't fit the usual patterns, this is where you pause and start to look a little closer. I had a female patient a couple weeks ago, and her only history was really having chronic Achilles tendonitis. Sometimes it'd be on the right side, sometimes it'd be on the left side. And when we started asking her all these questions, she was sent to us because one of her inflammation markers was high. And then, we asked about all the Achilles problems she's been having. And it turns out that many years ago, a couple decades ago, she was diagnosed with psoriasis, the skin rash. It had always been very mild. She has a little bit on her scalp, so it's not obvious. And so maybe people didn't even think about it. But when you bring that attention to a rheumatologist, we start thinking this could really be the diagnosis. And there's no blood test for psoriatic arthritis, which makes it all the more frustrating. So it really is, we have to think about these different patterns that are happening. Also remember that RA, rheumatoid arthritis, is definitely more common in women, but psoriatic arthritis is pretty equal among men and women. They tend to present differently. Men may have more disease in the spine or in the sacroiliac or butt joints, and women tend to have more fingers, toes, more peripheral areas like the ends of the body. They can have in the other places too. And women tend to have more pain with psoriatic arthritis that we're finding, but also they aren't picked up as early as men are with this condition. And it's so important to treat this early because you can get a lot of damage from this condition, not just to your joints, but also to your tendons and ligaments. But the good news is that if you're treated early, the new treatments are pretty effective. Not perfect, but pretty good. And we're finding more and more things every day that could maybe help people feel better. Nowadays, there are some studies that you can use GLP-1 medications along with the psoriatic arthritis medications, and people do even better. So all this to say, if your doctor suspects it, it's important to get in with a rheumatologist to get evaluated. And like I said, the x-rays may not be abnormal initially, but you can also get an ultrasound or MRI, or sometimes, like I said, just a pattern. If a rheumatologist goes through all this and they feel pretty confident, they may just go ahead and treat. And another clue here is that this type of inflammation, it doesn't just affect the joints, the tendons, the ligaments. It's actually system-wide inflammation. So we see issues with heart disease and other problems, metabolic syndrome, associated with psoriasis and psoriatic arthritis. Another reason why it's good to get treated and seen early so that these can be taken care of so that you can hopefully live longer, but also live healthier. So if your feet hurt and you're feeling tightness, stiffness, or even a sense of fullness in the area, not just sharp pain, and it's been going on, or it comes back and forth, or it goes away and then it manifests again, it's important to get this looked at, especially if you have a history of psoriasis. And there are some people who present backwards where they develop the arthritis first, and then later, years later even, they can develop the skin rash. And yes, it can be very confusing because we always love to have the rash first. It's just easier to make the diagnosis, but it doesn't mean that the diagnosis won't be made. It means that you need a curious person to really look into those symptoms because it can be challenging and often easy to miss because it may not look like a classic arthritis that you're used to thinking about. If you have psoriasis, have you ever noticed joint or foot symptoms like the ones I just spoke about? What time of day do they bother you the most? Drop a comment. I talk a lot about how autoimmune conditions evolve and different ways to treat them. So if you're trying to understand that better, you may find some of my other videos helpful too. I'm Dr. Neha. See you next time.